Imagine this. You're sitting on your sofa, perfectly relaxed, watching your favorite show. The doorbell rings. You jump up to answer it, but halfway there, the world starts to tilt. Your vision goes dark around the edges, a cold sweat breaks out on your forehead, and your heart starts thumping against your ribs like a trapped bird. For a terrifying 5 seconds, you aren't sure if you're going to stay upright or collapse onto the floor. Most people call this a head rush. Doctors call it orthostatic hypotension. But what if I told you that for millions of people, this isn't just a random glitch? What if I told you that the standard advice, just drink more water, is actually missing the most dangerous and complex part of the puzzle? Today, we are going to dive deep into the mechanics of your vascular system. We are going to look at what is actually happening inside your veins the millisecond you stand up, why your brain is screaming for oxygen, and the 3 hidden silent triggers that your standard blood tests are probably missing. If you've been told it's just stress or it's just dehydration, you need to pay close attention because the real cause might be hidden deep within your autonomic nervous system. This is the medical deep dive into the dizziness no one explains. Chapter 1, The Physics of Blood, the Gravity Tax. To understand why you feel like you're about to pass out, you have to understand a fundamental law of physics, the gravity tax. Your body is a vertical column of fluid. The moment you move from a sitting or lying position to standing, gravity instantly pulls between 500 and 700 milliliters of your blood downward, straight into your legs, your feet, and your abdominal cavity. In a perfectly healthy body, your nervous system acts like a high-speed supercomputer. It uses specialized sensors called baroreceptors, located in your carotid arteries and the arch of your aorta. These sensors detect the sudden drop in pressure within milliseconds. They send a lightning-fast signal to your brainstem, which then triggers a sympathetic surge. This surge does 2 vital things. It tells your heart to beat faster and more forcefully, and it commands your blood vessels to constrict, acting like a pressurized hose. This mechanical response pushes the blood back up, defying gravity and delivering oxygen to your brain in less than a second. But when you feel dizzy, that computer is lagging. The signal is delayed or the hose isn't tightening. Your blood stays pooled in your lower extremities. Your brain is momentarily starved of oxygenated blood, a state known as cerebral hypoperfusion, and the lights start to flicker. This is why you see stars or spots. This is why your muscles feel weak for a moment. But the million-dollar question we have to answer is, why is your system lagging in the first place? Chapter 2, The Dehydration Myth and the Electrolyte Secret. The first thing every doctor, friend, or internet article tells you is to drink more water. And while it's true that low blood volume makes this worse, there is a massive secret that most people overlook. You can drink 4 liters of water a day and still be chronically dizzy. Why? Because water without the right electrical charge is just wet noise to your body. Your blood volume isn't just about H2O, it's about plasma concentration. If your electrolytes, specifically sodium, potassium, and magnesium, are out of balance, your body cannot physically hold on to that water in your bloodstream. Think of your blood vessels like a sponge. If the sponge is salty, it holds water. If the salt is washed away, the water just leaks out. If you are someone who follows a perfect low-sodium diet because you've been told salt is the enemy, but you suffer from frequent dizziness when standing, you might actually be starving your blood pressure of the very tool it needs to keep you conscious. We also have to talk about the aldosterone factor. This is a hormone produced by your adrenal glands that tells your kidneys to keep salt in the body. If your adrenals are fatigued or if your hormones are imbalanced, you could be flushing out the very minerals that maintain your blood pressure no matter how much water you chug. Chapter 3, The Silent Triggers, Postprandial Hypotension. If your hydration is fine, we have to look at the triggers that doctors rarely check during a standard 5-minute physical. The first is a condition called postprandial hypotension. Have you ever noticed that your dizziness is significantly worse after a big meal, especially one high in carbohydrates? This isn't a sugar crash. When you eat, your body redirects a massive, disproportionate amount of blood to your digestive tract to process the food. If your autonomic nervous system is already struggling to maintain balance, it can't handle the double whammy of digesting food and standing up at the same time. There simply isn't enough blood volume to go around. The blood stays in your gut, your brain gets the leftovers, and the room starts to spin. People often mistake this for being tired after eating, but it's actually a localized form of circulatory failure. Chapter 4, the nervous system, wiring, vitamin B12 and myelin. The second hidden trigger is the health of your wires. This is the vitamin B12 connection. This is the one that stays hidden for years because standard blood tests often have normal ranges that are actually far too low for optimal neurological health. Vitamin B12 is essential for the creation of the myelin sheath. Think of the myelin sheath as the plastic insulation around an electrical wire. If that insulation is worn thin or damaged, the electrical signals from your brain to your blood vessels leak out. They travel too slowly. It's like trying to run high-speed 5G internet through a rusty, frayed copper wire from the 1950s. The signal to constrict vessels arrives at your legs 3 seconds too late. By the time the signal arrives, you're already clutching the wall for support. If you are vegan, vegetarian, or over the age of 50, your B12 absorption might be compromised, and your slow wires could be the primary reason you feel lightheaded every morning. Chapter 5, the adrenal and cortisol connection. We cannot discuss dizziness without talking about stress, but not in the way you think. This isn't just feeling stressed. This is about the physiological exhaustion of your adrenal glands. Your adrenals produce cortisol and adrenaline, the chemicals that help regulate how your blood vessels react to movement and pressure. If you have been under chronic long-term stress, your body's stress thermostat can become broken. This is often called HPA axis dysfunction. In this state, your body fails to produce the necessary morning surge of cortisol that naturally tightens your vessels and prepares you for the day. This is why many people with burnout or adrenal fatigue find that they are most dizzy in the first 2 hours after waking up. Their system is essentially stuck in sleep mode, even though they are standing up and trying to move. Chapter 6, the immediate rescue protocols. So what do you do when the room starts spinning? Most people make the mistake of standing perfectly still and trying to fight it by holding their breath. This is actually the worst thing you can do because it further decreases blood return to the heart. If you feel the darkness coming on, you need to engage the manual muscle pump immediately. There are 3 specific moves. The leg cross. If you are standing, cross your legs tightly. This compresses the veins in your lower legs and forces blood upward. The glute squeeze. Squeeze your thigh and glute muscles as hard as you can. Your muscles act as a secondary heart, pumping blood back into the central circulation. The tense lean. Lean forward slightly and tense your abdominal muscles. Secondly, you should implement the preload strategy. If you suffer from morning dizziness, do not jump out of bed. While still lying down, drink 16 ounces of water, ideally with a pinch of high-quality sea salt, and perform ankle pumps, flexing your feet up and down 20 times. This wakes up your vascular system and gets the blood moving before you challenge it with gravity. Chapter 7, medication, the hidden culprits. Sometimes the what no one tells you is sitting right in your medicine cabinet. Many common medications have a side effect called orthostatic intolerance. It's not just blood pressure pills. Diuretics, certain antidepressants, especially older ones, anti-anxiety medications, and even some over-the-counter antihistamines can dampen the nervous system's ability to constrict blood vessels. If you started a new medication and noticed the dizziness began shortly after, your dose might be slightly too high, or your body might not be compensating for the drug's vasodilatory effects. Never stop a medication without consulting your doctor, but bring this specific symptom to their attention. It's a crucial clinical sign. Chapter 8, when dizziness is a warning sign. Is this always just a glitch? No. While most cases are related to hydration, minerals, or mild autonomic delay, there are times when dizziness is a siren. You must take this seriously if you experience syncope, which is the medical term for actually losing consciousness, even for a second. If you find yourself on the floor and don't remember how you got there, that is not a simple head rush. Other red flags include heart palpitations. If your heart feels like it's skipping beats or racing over 120 BPM just from standing up, a hallmark of POTS, postural orthostatic tachycardia syndrome. Chest pain, if the dizziness is accompanied by pressure in your chest. Neurological symptoms, if you have slurred speech, numbness in one arm, or a drooping face. Age of onset, if these symptoms suddenly start after age 50 without any change in diet or lifestyle, it could indicate an underlying heart rhythm issue or an early sign of a neurological condition like Parkinson's or multiple system atrophy. Chapter 9, the long-term recovery blueprint. To truly fix this, you have to move beyond quick fixes. You need to retrain your autonomic nervous system. First, look at your volume status. This means consistent hydration with minerals, not just plain water. Adding a small amount of electrolytes to your first liter of the day can be life-changing for many. Second, consider graded exercise. If your vessels are lazy, you need to strengthen them. Recumbent exercise, like using a rowing machine or a recumbent bike, is excellent because it allows you to build cardiovascular strength without the stress of being upright. Over time, this increases your total blood volume and makes your heart more efficient at pumping. Third, check your B12 and iron levels. Anemia, low iron, means your blood is thin and can't carry enough oxygen. Low B12 means your nerves can't send the signal. Fix the fuel and fix the wires, and the system usually follows. Conclusion, your body is a pressure system. Your body is a finely tuned instrument of pressure, flow, and electrical signals. Dizziness isn't a normal part of getting older, and it's not something you should just live with. It is a signal, a check engine light for your vascular system, telling you that something in the chain of command is broken. Whether it's a lack of minerals, a slow nerve signal, or a digestive blood heist, your brain deserves the oxygen it's asking for. Listen to what your body is telling you when you stand up. Don't just ignore the spin, trace it back to the source. If you found this deep dive helpful, share it with someone who's always complaining about head rushes. It might be the most important piece of health information they receive all year. Stay hydrated, stay grounded, and keep your head up slowly.